Most men have absolutely no idea that prostate cancer can begin quietly, with subtle changes that feel normal, harmless, or just part of aging. By the time obvious symptoms appear, the disease may already be advanced, and that's the dangerous part. Prostate cancer is one of the most commonly diagnosed cancers in men worldwide, yet in its early stages, it often whispers instead of screams. In today's video, I'm going to walk you through 13 early silent signs of prostate cancer that can appear months, sometimes even years before diagnosis. Some of these signs seem minor, some are easy to dismiss, and the last few are the ones most men completely ignore. Now, very important, these symptoms do not automatically mean cancer. Many can overlap with non-cancerous conditions like prostate enlargement or infections. What matters is persistence, progression, and combinations of symptoms. Before we begin, tell me in the comments your age and where you're watching from, and let me know which symptom concerns you the most. Awareness saves lives. Let's begin. Number 1. Frequent urination, especially at night. One of the earliest and most common silent signs is needing to urinate more often, particularly waking up multiple times during the night. The prostate sits just below the bladder and surrounds the urethra. When abnormal growth begins, even in early stages, it can subtly press against the urinary channel. At first, it feels harmless. You might blame it on drinking more water, tea, or simply getting older. But if nighttime urination becomes consistent and disrupts sleep, it deserves attention. Number 2, a weak or slow urine stream. Many men notice their urine stream isn't as strong as it used to be. It may start strong and then weaken, or feel less forceful overall. This happens because the urethra is being partially compressed. It's gradual, it's painless, and that's why it's ignored. Number 3, difficulty starting urination. You stand there waiting. The urge is there, but the flow doesn't begin immediately. This hesitation can be one of the earliest mechanical signs of obstruction around the prostate. Men often assume it's normal aging, but persistent hesitation is not something to brush off. Number 4, feeling like the bladder isn't completely empty. Even after urinating, you may feel like there's still urine left. That lingering sensation can happen when the prostate interferes with full bladder emptying. Over time, this incomplete emptying may increase the risk of infections or further irritation. Number 5, urgency to urinate. Suddenly feeling a strong, immediate need to urinate, even when the bladder isn't full, can also be an early warning sign. This urgency happens because pressure changes around the bladder and urethra affect normal control signals. Number 6, mild burning or discomfort during urination. While infections commonly cause burning, persistent mild discomfort without infection can sometimes signal irritation or inflammation related to prostate abnormalities. Again, not panic-worthy, but persistent. That's different. Number 7, blood in your urine. This is never normal. Even small amounts of blood, sometimes only visible under testing, can indicate that abnormal tissue is affecting surrounding structures. Many men never see visible blood, but if you do, seek evaluation immediately. Number 8, blood in semen. This is less talked about, but it can be an early sign. Because the prostate contributes fluid to semen, abnormal growth can sometimes affect that fluid. It may happen once or repeatedly. Either way, it's something to discuss with a doctor. Number 9, pain or discomfort during ejaculation. In early stages, prostate changes can create subtle discomfort during ejaculation. Many men feel embarrassed discussing this, but sexual symptoms are sometimes among the first clues. Number 10, erectile difficulties. While erectile dysfunction has many causes, including stress, vascular disease, and diabetes, sudden or progressive changes combined with urinary symptoms should not be ignored. The nerves responsible for erections run very close to the prostate. Pressure or abnormal growth can sometimes interfere with normal function. Number 11. Persistent lower back, hips, or pelvic discomfort. Early prostate cancer rarely causes severe pain, but dull, nagging discomfort in the lower pelvis, hips, or lower back that doesn't resolve can be a warning sign. Most people blame posture, gym strain, or aging joints, but persistent deep pelvic discomfort deserves attention. Number 12. Unexplained fatigue. Cancer cells compete for energy. As the body responds to abnormal growth, subtle fatigue can develop. Not extreme exhaustion, but a noticeable drop in stamina. If fatigue appears alongside urinary or sexual changes, that combination matters. Number 13. Unexplained weight loss or loss of appetite. This is usually a later sign, but sometimes it appears earlier than expected. If you're losing weight without trying, or your appetite drops for no clear reason, it's important to investigate. Now, let's pause for a moment. If you're experiencing one of these symptoms occasionally, that does not mean you have prostate cancer. But if you notice a pattern, multiple symptoms together, increasing frequency or progression over time, that's when action becomes critical. Early prostate cancer is often highly treatable if caught early. Screening tests like PSA blood tests and prostate exams exist for a reason, and while screening decisions should always be discussed with a healthcare professional, ignoring symptoms is never the solution. Your body speaks in subtle signals before it screams. Frequent urination, weak stream, blood, pelvic discomfort, sexual changes, fatigue. These are not things to feel embarrassed about. They are things to be aware of. If this video helped you, share it with the man in your life, fathers, brothers, friends. Early awareness can save someone years of suffering. And if you want more medically explained warning sign videos like this, subscribe and turn on notifications. Take care of your health. Your future self will thank you.